This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome back to Behind the Headlines. On the second segment, Jere and I are happy to welcome to the show Scott Bishop. Scott is the Senior Vice President of the Hospital and Healthsystem Association of Pennsylvania. Scott, welcome to the show.
Thanks for having me.
Well, it's nice to have you here to talk about healthcare. Continues to be one of the most important topics in state government. And of course, we are attempting to cobble together another state budget at this very moment here on Capitol Hill in Harrisburg. How did this most recently, I guess we can say, approved state budget for last year, how did that end up impacting hospitals and healthcare in Pennsylvania?
Well, it was a good budget for Pennsylvania hospitals. The legislature, I know it was a long, difficult process for them, but really the legislative vehicles they put forth, they were all about equitable funding, the right funding for hospitals, and so we're glad to see that their work, was ultimately enacted into law as the state budget for the 15-16 fiscal year, and they continue to do that same great work in preparing for the 16-17 fiscal year. So we're hopeful for an on-time budget. We're hopeful for a budget that continues the same funding that the legislature started in 15-16. And we're hopeful we'll get there. So I think that we're at that point in time where we have to wait and see how the next couple of weeks unfurl and that work that gets done. But we're off to the on the right track with the legislature. And I do think it's important that when we talk about the governor's outlook, one of the things that we do think is the right way to look at things is he has talked about the importance of maybe increasing some of the taxes related to tobacco use and products that are a part of the culture these days, and hospitals have always thought that that's an appropriate place to look for, using tax as a disincentive to, what are fairly unhealthy practices. So I think, generally speaking, we're looking, as a very optimistic look at the 16-17 budget from the perspective of hospitals. Again, recognizing that there are a lot of challenges that legislators and the administration are looking at with regard to the big picture. But I think from a hospital perspective, we feel pretty positive.
Well, I know you and your members have been doing a good job too to help the legislature and the governor in order to keep spending down, state spending down, by keeping spending down on health care.
Yeah.
And one of those areas I know is the telehealth, and I know that would go a long way in trying to keep the increases of spending down and maybe even have some savings that would then try to help us stay within our current budget, which helps the legislature and the governor. Tell us more about the telehealth.
Right, so you're right about healthcare. It's always changing, and that's a positive thing because, whether it's technology or it's bricks and mortar, I mean, hospitals and healthcare providers are always trying to stay ahead of what, they need to be doing. And the telehealth component of that is making sure that technology is used to the best way it can be with regard to the healthcare needs of folks, and it's the same quality care that you get if you were walk into a physician's office or you go into a hospital in many cases, but we just make good use of the technology that's available to us, and why wouldn't we want to do that? So I think it's one of those issues where it's happening now, but the technology and the healthcare and the needs, they're kind of at one stage, and the legislative process and some of the the minutia that goes with that is at a different stage, and we're going to try to bring those two more together.
What are the practical uses, Scott, for telehealth?
Yeah, so I think you can look at it a couple different ways. I think, and starting at the most important, I mean, telehealth is a life-saving process for healthcare. And I'll give you a very easy example we refer to as telestroke. So if you think when a person has a stroke, think of it this way: there are just about 2 million brain cells die each minute that a stroke is happening, right? And so the difference is really in minutes when it comes to trying to care for a patient like that. And what telestroke does is if a patient comes to a hospital that doesn't have a neurosurgeon, that hospital can use technology to have basically a neurosurgeon come right into the room with the emergency department physician and nurses, and then help that physician and nurse on site assess what's going on with the patient, ensure that it is a stroke, go through the battery of tests, and then help that patient understand, here's what the best course of treatment would be for you right on the spot, and then either get the patient, if he or she's able to do so, or their family or whatever, to make that decision. And the difference can mean a patient walking out of an emergency department, day or two later, versus spending, years in a rehabilitation facility or something because the treatment protocols weren't, initiated when they could have been. And so that's probably the most dramatic example of telehealth. A second important example is if you think about teledermatology. We all, I'm fair-skinned, so every now and then there's things happening. Well, you should get that looked at, but it's a hassle. You have to wait for a dermatologist, or especially that there are not a lot of them. And so the idea of teledermatology is being able to take a picture of whatever the surprising thing is, and you send a picture, and 9 times out of 10 maybe it's look, it's a normal whatever. The next time you can make an appointment to come in, great. Or it could be something where a dermatologist would say, hey, that looks like it might be something. We should try to get you in, and preventative care and stuff like that is always important. We have tele-urgent care. That's a kind of a new trend, and when you can't get to see your family doc, you might go to an urgent care center. We've got hospitals and health systems that have that process, and where, again, you're not going to, if a physician needs to see you, if you need to be seen in person, they're going to say, hey, this is something you need to see. But maybe it's something you can, instead of going and waiting in line and sitting there, you can go on the queue, you can have something looked at. So there's all those kinds of things, and then to just the normal. We're a country where I think we're at 2/3 of us are using smartphones, and there's a lot of aspects of telehealth. Where you could go and just have regular appointments, regular things that you're doing just right with your phone. So all those are different ways in which telehealth can improve the healthcare of folks, and it improve costs in any number of different ways. Every time you don't have to, the expense of driving, traveling, whatever the case is. So there's a lot of different ways in which it does that. But that's it. I mean, and again, it's all about making sure patients have the right care at the right place at the right time. Not substituting if you need to be seen in a facility or you need to be seen by a physician. But for those times where you could do it from the comfort of your own home, we want to try to do that.
Yeah, definitely have to commend you and the association and all your members, all the hospitals out there for using those dollars wisely. A lot of times there's criticism about the fact, well, you're nonprofit or you're healthcare, you're making money off of the sick, but you need to have those reserve funds. You need to be making money to be able to go back and reinvest, as you just talked about.
Yeah.
Getting people out of the emergency room queue, where that's the most expensive care, into the urgent care. That took a lot of money from the hospitals to do that, and to reach out to the community, and also with this telehealth. So I want to thank you and all the hospitals for doing that. I think you need to do a better job, though, at communicating that to all the citizens across the state. But hopefully this show will do that.
Right.
That's the reason that you need to have those reserves.
Technology is not inexpensive. I mean, it doesn't matter if it's healthcare or anything else. And I think hospitals are making those investments. And part of the need for legislation is to ensure that there's reimbursement and coverage from insurers on these issues, because listen, hospitals, they want to do these services. They want to make sure that if a stroke patient comes to emergency department, they have a way to have a neurologist come in and be a part of that. But you're right, it's an investment. If they're investing in that, then it's hard for them to keep spreading those costs around all the different services that need to do. And so that's one of the key aspects of the legislation, which is to say, look, we think that insurers should cover, whether or not they're walking in and seeing the neurologist right by the bedside, or if they're being, in the room via technology, that should be covered in a like manner. So it's a key aspect.
Scott, you're one of the most important individuals in the association to deal with the relationship between the association and all your members and state government. What are the pieces of legislation in regard to telehealth that you are keeping an eye on at the Hill right now? What, if you were speaking to the legislators that are watching, or some of our viewers, which ones would you single out?
So we've got two great champions at the moment, one in the Senate, one in the House, Senator Elder Vogel from Beaver County in the northwestern part of the Commonwealth, and Marguerite Quinn in the southeastern suburbs, who are right now working on legislation to introduce, we don't have our bill yet, but to introduce that would allow for kind of three main components, kind of defining what telehealth is, making sure who provides telehealth, some licensure, things like that, and then the kind of the reimbursement side of things. And so right now we're working with stakeholders, physicians, insurers, others, to try to get us to a place where those bills can actually, start to move forward in the legislative process. But we're fortunate because we've been across the Commonwealth talking to our members and legislators, giving them real live examples of telehealth, and they get it and they understand it, and they're like, yeah, this is kind of a no-brainer, and now it's just a matter of getting, as the legislative process, as you know, getting all those details into place.
Okay, thank you very much, Scott. Unfortunately, we're out of time already. The time always slips by way too quickly. We hope you'll come back very soon and give us an update. And we'll be back next week with all of you to give you an update on Behind the Headlines. Tune in then.